The development of thyroid antibodies, which are diagnostic for thyroid autoimmunity, occurs years before we see changes in TSH and before we reach the diagnostic threshold to be able to say that someone has hypothyroidism. Hey guys, Dr. Bodle here. It's good to see you as always, and thank you for hanging out with me. Now today, I wanted to talk about how Hashimoto's can cause low thyroid symptoms before you've been diagnosed with hypothyroidism. But for us to get into that, we're going to need a little bit of context around the actual diagnosis of hypothyroidism. As you probably know by now, if you've been watching any of my videos, I'm not a huge fan of the diagnosis of hypothyroidism because I feel that it is incomplete. For someone to be diagnosed with hypothyroidism, we're looking for changes in lab values and the presence of low thyroid symptoms. Specifically, those lab values include an increase in TSH and a decrease in either total T4 or free T4. Now, real quickly, the reason why there's this kind of opposing representation by our markers here is because T4 is produced by our thyroid gland. And if it starts to become low, there's something wrong with our thyroid gland. It can't do the job that it's normally intended to do. The reason why TSH is high, on the other hand, is because TSH is released by our brain. Our brain is always monitoring our hormone levels in the body, and that includes thyroid hormone levels. And if it senses or realizes that those T4 levels are starting to trend low, then it's going to try to do everything in its power to bring those levels back up to normal. The way that it does this is it increases the stimulus or motivation or activation of our thyroid gland. And this is all facilitated by TSH, which stands for thyroid stimulating hormone. Now, sometimes this works and the change in thyroid hormone production is only transient. And the thyroid says, yep, I got that message, brain. I'm back on the job. I'm doing what I'm supposed to be doing. And sometimes it doesn't matter what the brain does, because even though it's trying to stimulate the thyroid, there's some other problem that's going on and it's preventing the thyroid from functioning. Sometimes I'll have patients think about this relationship between the brain and the thyroid as though they were in a workout class or working out with a trainer. You know, you're getting to the end of your training session, you've been doing a ton of push-ups, and your trainer's like, hey, let's get one more push-up in. And you're thinking by this point, you know, I'm pretty spent, I don't know if I can do it. So your trainer sees this and gives you a little bit more motivation by getting a little bit louder, getting a bit more excited, you know, really trying to jazz you up. And because of all of this encouragement, you're able to get just one more push-up done. And of course, in your mind, you're thinking, you know, great, I did it, I'm all done, good to go. But then your trainer comes back at you with, all right, we did that last one, but let's get one more. Well, maybe by this point, your body really has given everything that it's got, and there isn't any way that you can do any more push-ups. Well, it doesn't matter how much the trainer jumps and screams and shouts and does whatever, you don't have the capacity to do that push-up. So just like our brain might release a ton of stimulating hormone, if the thyroid can't do its job because it's being impaired, because there's something that is interfering with the way that it works and the way that it functions, then all the motivation in the world isn't going to make much of a difference. But in the world of healthcare, and when it comes to making certain diagnoses, we have to meet certain standards, thresholds, and criteria to say that someone qualifies or matches a particular condition. And to say that someone has hypothyroidism, they have to meet all these parameters. They have to have the increase in TSH, the low T4, and the low thyroid symptoms. And if they don't check all those boxes, then we technically can't say that they have hypothyroidism, even if they have a lot of the symptoms that are associated with hypothyroidism. The problem here is that for a lot of hypothyroidism and other chronic conditions, these things are not black or white, on or off, diagnosis or no diagnosis. Instead, they tend to be very progressive in nature, where in the beginning, symptoms start out as mild, and as things change and develop, they start to get worse and worse over time. In my mind, I think of it a little bit like a fire that is burning through a town. Now, in this town, they have specific guidelines that tells them when that fire is severe enough that they then need to take action and respond to it. But let's say that that threshold that needs to be met is 50% of the town being burned down. Hopefully that is never the case. That seems like a bit much, but hang with me for argument's sake. But the reason why this town has that threshold is because they only have so many resources. And if they try to respond to every little fire that gets started, they won't be ready for the big one when it actually happens. But if the plan is to wait and try to prevent the catastrophic from happening, we shouldn't ignore the fact that there's still damage occurring, and that still needs to be managed and handled. But whether it's a fire or issues with our thyroid, we want to look at the damage or symptoms that are already occurring and come up with a plan to address them. And we'll also want to identify what caused the fire in the first place. That way we can limit or avoid it in the future. So when it comes to Hashimoto's and the reason why it can cause symptoms before we're diagnosed with hypothyroidism is because Hashimoto's is that fire in the early stages. Now, we've all been told that the only way that we can experience low thyroid symptoms is if we're hypothyroid, if we're not making enough thyroid hormone. But this isn't the case. Hypothyroidism can be caused by a number of things, whether that's thyroid removal, radioactive iodine therapy, infections, chronic inflammation, nutrient deficiencies, or interactions with other medications. But Hashimoto's, which is another potential cause of hypothyroidism, is a little bit unique in that the development of thyroid antibodies, which are diagnostic for thyroid autoimmunity, occurs years before we see changes in TSH and before we reach the diagnostic threshold to be able to say that someone has hypothyroidism. However, during that entire time where antibodies are present, we can still have damage and inflammation that leads to low thyroid symptoms. Even though, and this is a key point, our TSH and T4 are normal at that time. But again, how can we have low thyroid symptoms if our T4 is normal and we're not diagnosed with hypothyroidism? Well, when it comes to Hashimoto's, the mechanism isn't about the amount of thyroid hormone that we have, it's more about the inflammation and the way that our body uses that thyroid hormone. So when it comes to the actual mechanism of Hashimoto's, with autoimmunity, our immune system isn't functioning properly. And for whatever reason, it started to tag our own proteins and tissues with antibodies. Now, antibodies are proteins that our immune system makes, and they're normally there to tag viruses and bacteria and other pathogens to help let our body know that there's some sort of threat or foreign invader and we need to get rid of it. Now, of course, in the case of infection, that response is totally appropriate, but we don't want our immune system reacting to our own proteins and tissues. With Hashimoto's, these autoimmune antibodies are typically specified for two proteins, TPO and thyroglobulin. TPO is an enzyme that helps our thyroid to assemble thyroid hormone. And thyroglobulin is actually the protein backbone of thyroid hormone, which we attach iodine components to make T4. Once these proteins have been tagged or highlighted by antibodies, other immune cells see that tagging and respond accordingly, thinking that there's some sort of infection that needs to be dealt with. These immune cells then come in and infiltrate the gland itself, leading to damage and inflammation. Now, if this goes on for a long enough time, then yes, enough damage can occur, enough of the fire can burn to where we can't produce thyroid hormone like we should, and therefore we meet the criteria for hypothyroidism. But as I said before, that could take years, so that sort of change is a long way off. However, the diagnosis is less important, and what's more important is how you're feeling and functioning right now. And if this process of immune cell infiltration is already occurring, likely you're not feeling your best. This is because anytime there's tissue damage, there's going to be inflammation. Whether that damage is due to something physical, like spraining your ankle, or the damage is due to something that is immune mediated, like in the case of Hashimoto's or any other autoimmune condition. With thyroid damage, that inflammation tends to become systemic in nature. And whenever we have chronic or widespread inflammation, it's going to impair our body's ability to use thyroid hormone. This is because the binding sites or receptors in our cells don't function properly when inflammation is present. And if that thyroid hormone can't bind, then it can't activate our metabolism, and therefore things start to slow down. I've said before that you could have the best thyroid medication in the world, or your thyroid gland could be functioning perfectly, but if something is blocking that last step and our thyroid hormone can't bind with our cells, then none of that matters. Hormones are one of the ways that our body communicates and integrates different systems. But just like you could have a great idea, write it down, and then try to mail it to a friend, if that mail never gets delivered, then your idea isn't going to be shared. If our hormone never gets delivered, then the function that it's supposed to help facilitate is never going to occur. So to lay it out one more time, because it's really important that we all get this. Hashimoto's is an autoimmune condition where our immune system makes antibodies that tag proteins in our thyroid gland that leads to other immune cells coming in and damaging the function of our thyroid gland. These antibodies develop years before changes in TSH, and in the initial stages, there isn't enough damage to meet the threshold to diagnose someone with hypothyroidism, even though they can be experiencing hypothyroid symptoms. The reason they're experiencing these symptoms isn't because a lack of thyroid hormone, although that may come later. Instead, it's because of the tissue damage that is mediated by our immune system, which then leads to widespread inflammation, which blocks our body's ability to use thyroid hormone. If our cells can't bind and utilize that thyroid hormone, then it manifests in the exact same way as if we were deficient in that thyroid hormone. In these situations, the way to fix the problem or the answer to our symptoms usually isn't to take thyroid hormone medication. One, because at this time we're not having a problem with low hormone or hormone insufficiency. And two, because even if we were to take that medication, we're still going to have a tough time binding it. So instead, we want to look to our immune system and find ways to support it while managing the inflammation. So if you have positive TPO and or TG antibodies and you're having all of these thyroid symptoms, but your doctor says you're fine because your TSH is normal, or you can't have thyroid symptoms because your T4 isn't low, or any other silly excuse, know that this is Hashimoto's, that the interaction of these antibodies and our immune system can cause thyroid symptoms, but it's simply happening in a progressive state before enough damage occurs where your doctor can actually understand it. But I hope that this video was helpful for you, and I know it can be a bit of a tricky topic, so make sure to let me know if you have any questions. If you did like the video, please remember to like, subscribe, and click the bell for new videos every Thursday. And if you want to work with me one-on-one, I am still in practice. I am still accepting new patients, although these days we have a bit of a wait list. And that is all the more reason to get that process started as soon as possible. That way we can create a plan and help you to feel better as soon as possible. All you need to do is send me an email at contact@seattlethyroidhelp.com. My staff will reach out to you and see if you qualify for a free consultation. If you're looking for other ways to learn and get more information on Hashimoto's and hypothyroidism, check out my free downloads in the description, or you can follow me on Instagram or Facebook. But that's it for today. I hope that these videos are continuing to support you on your health journey, and I want to thank you for all the love and support that you've shown to the channel. It certainly doesn't go unnoticed, and it means a ton to me. But my name is Dr. Bodle. I hope you guys have a great rest of your week, and I will see you in the next one.